If you or someone you love has been told they need gallbladder removal surgery, you might have a lot of questions. Don't worry, cholecystectomy or gallbladder removal is one of the most frequently performed surgeries worldwide. Today, we'll walk through what the surgery actually involves, how to prepare for it, what happens during and after the procedure, and lifestyle and dietary habits that support a smooth recovery. At the end, we'll highlight the initial challenges of life without a gallbladder, so stay with me. To understand the surgery, it helps to know the role of the gallbladder itself. This small, pear-shaped organ sits just beneath the liver and stores bile, a digestive fluid that helps break down fats. When gallstones, infections, or chronic inflammation start causing persistent symptoms, removing the gallbladder becomes the most effective long-term solution. And that brings us to the different ways the surgery can be performed. There are two main approaches, and your surgeon will choose the safest one based on your condition. One is laparoscopic cholecystectomy. This is the most common method. Through a few tiny incisions, the surgeon inserts a camera and instruments to remove the gallbladder. Because the cuts are small, recovery is usually quicker and less painful. 2. Open cholecystectomy. In more complex situations, like unexpected bleeding, significant scar tissue, or suspected cancer, a larger incision is needed. Recovery takes longer, but this approach provides the visibility and access required for a safe operation. So, why is gallbladder removal needed anyway? Most people undergo cholecystectomy because of complications from gallstones. Your healthcare team may recommend surgery if you have painful gallstones, stones blocking the bile duct, gallbladder inflammation called cholecystitis, large polyps in the gallbladder, pancreatitis caused by gallstones, and concern for gallbladder cancer. Interestingly, many people have gallstones without symptoms, and they don't need surgery. But once symptoms begin affecting daily life, removal becomes the most reliable fix. Now that we know the why, the next step is preparing for the procedure. Preparation is straightforward, but important for your safety. Your surgeon may ask you to 1. Pause certain medications or supplements. Some may increase bleeding risk, so always share a full list with your healthcare team. 2. Stop smoking. Stopping smoking before a cholecystectomy is crucial for a successful recovery. The World Health Organization has shown that stopping smoking reduces the risk of complications following surgery by up to 50%. In addition, smokers are 38% more likely to die after surgery than non-smokers. The most benefit is achieved if you stop 4 to 6 weeks or more before surgery, but even stopping 2 days before can be beneficial. 3. Avoid eating the night before surgery. You can take essential medications with a sip of water, but refrain from eating or drinking for several hours before the procedure. Once you're prepared, the next question is, what actually happens in the operating room? Here's a simple breakdown of what you can expect. During a laparoscopic cholecystectomy, several small incisions or cuts are made in the abdomen. Carbon dioxide is used to gently inflate the abdomen to create space and improve visibility. A camera and instruments are inserted. The gallbladder is removed, and the incisions are closed with sutures. On the other hand, during an open cholecystectomy, a single larger incision is made below the ribs. Muscles and tissues are moved aside. The gallbladder is removed, and the incision is closed. Both procedures are done under general anesthesia, and like any surgery, there are risks to be aware of. Generally, complications are uncommon, but they can include bleeding, infection, injury to a bile duct, which is one of the tubes that carries bile in and out of the liver, leakage from the bile ducts, injury to liver or bowel, deep vein thrombosis, DVT, which is a blood clot in the large veins of the legs, for which you may be asked to wear elastic stockings before and after surgery to prevent this, and complications or side effects from the general anesthetic, such as a chest infection. Your personal risk depends on your overall health and the reason for surgery. Once the procedure is complete, recovery begins. After surgery, you'll wake up in a recovery area before being moved to a hospital room. Following laparoscopic surgery, most people go home the same day or after one night, and full recovery usually takes about a week or slightly longer. In the case of open surgery, a hospital stay of about 2 to 3 days is expected, followed by 4 to 6 weeks of recovery at home. Now, as your body heals, your diet plays a big role in how comfortable your recovery feels. So, let's talk about what to eat during the recovery period after the surgery. Generally, you do not need to follow a specific diet after your gallbladder has been removed. However, without a gallbladder, bile flows directly into the intestines instead of being stored. This can temporarily affect the digestion of fatty foods, so the recommended foods are lean proteins like fat-free chicken and fish, whole grains like brown rice, oats, and whole wheat, high-fiber fruits and vegetables like apples, berries, beans, lentils, and spinach, low-fat dairy like non-fat milk, nuts and seeds like almonds and flax seeds. Now, here are some extra dietary tips to help speed up recovery. Eat small, frequent meals. Avoid overeating. Drink plenty of water and reintroduce foods slowly. As your diet stabilizes, you'll also start adjusting to life without a gallbladder. Most people return to normal life without major issues, but some temporary changes are common. Digestive issues can occur due to the bile flowing directly into your intestines. It may lead to symptoms like bloating, diarrhea, and indigestion. Difficulty in digesting fats may occur, causing nutritional deficiencies of fat-soluble vitamins A, D, E, and K, and greasy stools. Some people experience ongoing symptoms like nausea, gas, or abdominal pain even after surgery. This condition is called post-cholecystectomy syndrome. The good news is that these symptoms usually improve with time. A balanced diet, gentle physical activity once cleared by your doctor, and following your post-surgery instructions all help your body adapt smoothly. If you found this helpful or know someone who will, feel free to share or like. Thanks so much for watching. See you in my next video.